Oh, hi, my name is Juliana Regis da Costa e Oliveira, and my student number is 881064149. And today we're going to record the section 1, Conduct Manual Tasks Safely, for Unit 411-412. Hello, Avery. Ready for today's training section?
Yes, I'm ready.
Okay, great. So today's section is focused on one of the most important aspects of your role, is the safe manual handling.
Nice.
So this includes helping residents move, transfer, and maintain comfort without putting yourself or them at a risk. Okay, I will use techniques that align with workplace health safety procedures. So our goal is to make you feel more confident and safe doing these tasks every day. So today you're gonna work step by step. I will guide you first and then you press it together. Let's get started.
Yes, let's get this done.
Okay, let's go. Okay, Avery, so first of all, we're gonna start with some basics things about the manual handling, okay? So I have here the PowerPoint, and then you're gonna do some basic things. I think it's very important before practicing.
Okay.
Okay? Okay. So what do you think? What's mean manual handling?
I think it's when you have to use your hands to do or to perform some tasks during your shift or when you are working. But related to have lifting or carrying loads, and it can cause harm physical, then because that we have this protocol and training and techniques.
Yeah, it's true. So the manual handler can define manual handler any activity that requires you to use your force to push, to pull, to carry, to lower any person, animal, or thing. So it's in your role as a carer. So you must perform, you must know, you must do it, the manual handling technique every single time, every single day. So this is so important to know more about it, okay? And if you try to use unsafe techniques, it can cause a lot of injuries, especially in your shoulders, especially in your back, in your neck, okay? And it can impact in your quality of life and for sure in your workday.
Workers' comp.
Yes. So what we can do to prevent those injuries? So the most important is to know about your spine. So as you can see here in this image, in this photo, so this is our spine. So you can see that you have normal curves, our spine.
Yeah.
And when you need to perform the manual handling, you must keep your spine in this position. You need to keep your spine in a neutral position.
Can't bend.
Yeah, don't bend, don't do a lot of extension, or some people say, keep your back straight. Yeah, yes. So try to avoid this. Otherwise, you're gonna start to have more risk to develop this kind of injuries. Okay, so you need to preserve the curves of your spine. And you can tell me, okay, Juliana, but how I can do this? It's quite difficult when you need to think every single time you need to do like a task. I need to think about my spine. Yes, I can see it's true, but you have a special muscles around, especially around our waist, is the abdominal muscles that can can keep our spine in a neutral position when we need to perform these tasks. Okay.
Okay. Activate them.
Yes.
Muscle.
When you start to do your task, so try to engage the core, so engage the muscles in your waist before starting do whatever we need to do with the resident, okay? Or we need to maneuver the machine, or you need to pick something from the floor. So try to engage first the muscles and then perform the task, okay? Okay, and then you can tell me, okay, so I understood everything. So I need to keep my spine in a neutral position. So I need to engage the core to keep my spine in a neutral position. And what else? What I need to do? So in a manual handling, to perform the manual handling techniques safely, you have some principles. So the first one, as I told you before, you need to keep your spine in a neutral position. Then engage the muscles, the abdominal muscles, your core muscles, to keep your spine in a neutral position. Then try to keep your feet a little more hips apart. And why we need to keep your feet a little more wide apart? Because if you increase your base of support, you have more balance. It'll be easy for you to keep the muscles engaged, okay? And then try to use more your legs than your arms or in your back. And why is this? Because the legs are stronger than your arms or your back. So you can use them and don't be tight, and don't be tired, and don't be injured, okay? And try to avoid twisting, bend your back, because you're gonna increase the risk of injuries. And the other good point, to keep everything close to your body. You're gonna discuss this a little bit later, but keep everything close to your body. If you keep these things in your mind, you're gonna be able to perform your task safely, okay? But you need to do something with the residents here. The other good point, so in the place that you work, you need to follow the no lift policy. And what does it mean? So it means that a person must be not manually lifted except in an emergency or life-threatening circumstances. So don't try to use your back, your arms, everything that you have to help the resident. So here we have the machines. So have a stand-up lifter, a full sling lifter to help you to transfer the resident to a chair, or to what else? To a recliner where the resident wants to go. Okay, so you have equipment here that can help. Okay, you can guide the movement, you can give a little help, but don't use too much your strength to help them. We have the machines to do it. Okay. So when you think about the no lift policy, you need to keep 3 things in your mind. The first one, to never lift most or all of the resident's weight. Okay. The second point, we must encourage and assist the residents to do everything for themselves that they possibly can. Okay. For sure, in line with their care plan. Okay. Wow. If they can do something, so ask them to help you. So it's good for them to keep their mobility. Now, to keep their moving their bodies. Otherwise, you're gonna be weak, and it will be more difficult for us to help them. And the third main point, so we must use the mechanical or other equipment to lift or move the residents who are unable to safely move themselves. Okay? So keep in your mind, don't use too much your force. Ask for the residents to help you if they can, and use the machines if you need it. Okay?
Yeah, got it.
Okay, so when you perform the tasks, the manual handling tasks, as I told you before, so you need to use more your legs than your arms.
Okay.
Because your legs are stronger than your arms. And the most common movement you need to do it is the same squat position.
What?
Yes.
Okay.
So when you do this, you need to use more your hips and knees, not just your hips. I will show you. And try to keep your spine in a neutral position. And don't forget to tight the core muscles. Okay, I will show you.
Sure. Should I stay quiet?
Okay, so now I will show you the most common movement you need to do when you need to perform your task. Okay, so it's the same squat position. So as you told before, so you need to keep in your mind the principles of the manual handling. So keep your spine in a neutral position. Don't forget to engage the abdominal muscles. Keep your feet a little bit more hips apart, so it'll be easy for you to engage the muscles. Then you're gonna use the hips and knees to do whatever you need to do, okay? Don't try to use only your hips, otherwise it'll be very difficult for you to keep your spine in a neutral position. So try to use hips and knees when you need to perform your task. For example, if you need to pick something from the floor, so use your hips and knees, keep your spine in a neutral position, and go down, okay? So it's easy for me to keep the principles of the manual handling and perform my tasks safely. So to perform the other tasks, like move the resident in bed, so you need to shift your weight, so side to side. So you're gonna keep the same. So you're gonna keep in your mind the principles of the manual handling. So it's not the same squat position, it's another movement with your legs, but you're gonna keep the principles of the manual handling. Do you know what they are? So I will let you know again. So spine in neutral position, you need to engage your core and then use your hips and knees. So when you need to move someone, for example, up in bed, you can do this and you're gonna be totally safe when you need to perform your task. Or when you need to roll someone in bed, so you need to shift your weight backwards and forward. So the same, so my spine in a neutral position, my abdominal muscles are on here, and I'm using my legs much more my legs than my arms or back. And then I will move someone to roll in bed, okay? So, but sometimes I need to twist, I need to do something, quick to help someone. And as I told you, so you need to avoid twisting or bend too much your back, because you're gonna can hurt yourself. So what you can do it in this case, so the same, keep the principles of manual handling in your mind. So spine in neutral position, core on, and hips and knees working, and then try to pivot, and for this you don't need to bend or twist your back. You're gonna do this safely, okay? When you need to change your position suddenly. So this is a little practical part to show you how you need to perform your tasks safely. So could you show me if you're able to do it?
Yeah, for sure. Let's do this.
Okay, Avery. So now you're gonna press the most common position that you're gonna use when you need to perform your tasks. So the same squat position. So tell me what's the principles of the manual handling, and then show me how we need to perform the same squat position.
Your principles are neutral spine, feet apart, and use the hips and knees, and activate the core.
Okay, well done. So now show me how you need to perform the same squat position when you need to do your tasks.
Neutral spine and hips, activate the hips and knees.
Well done. So let's imagine like something it's on the floor. You need to pick these things on the floor. And try to,
Use
yeah.
your spine, hips and knees.
Well done. Okay, so good job. As you demonstrate here, the technique and what you need to use the same squat position. The other point when we discussed a little bit before is the correct lift. So I want you imagine like a baby. If you need to hold like a baby arm's length and shoulders height, how long you can do it? Maybe a few seconds.
Yeah.
But if you hold a baby at your chest, you can do for hours, isn't it? Yes, much more than instead of this position. So the same you're gonna apply for the manual handling. Okay, so it's easy for you to keep everything close to your body, especially between your shoulders and hips. So it'll be easy for you to perform your tasks.
Okay.
But if you do overhead or too low for you, you're gonna use much more your arms, you're gonna use much more your back, and then you can have much more risk to develop some injuries in these parts. Okay? So try to keep everything close to your body, and then it'll be easy for you to perform everything you need to do it. So now, just before we start to perform your task with the residents, so a few things you need to keep in your mind. The first, check the resident care plan. And why you need to do this? Why do you think you need to check the care plan?
Make sure patient doesn't have or does have spine injuries, hip injuries, recent surgeries, or devices like catheters and stuff like that. And what's the recommendation if patient needs like two assistant, one staff, three staffs, three.
Yes, well done. So make sure what they need. So if you need like a machine, or like a service steady, or a full lifter, or a stand-up lifter, 1 assist. So the equipment that you're gonna use with them. So you need to make sure. So you need to check the care plan. So the care plan is there. Okay. Then you need to get everything that you need. So, for example, if they need a full sling lifter, so you need to collect the sling, so you need to get the machine, and the other staff to help you. And then you need to explain what you're gonna do with the residents. So you need to talk with them about what you're gonna perform at that time. Okay, so if you need to use the full lifter, so you can say, hello, Louis. So today you're gonna go to your chair, your princess chair. So are you gonna use this machine to help you to go there? And then you can explain to them step by step, and then they can feel more safe during the whole process. Okay, and don't forget to perform the hand hygiene. So we did this section.
The one.
Yeah, the first one.
Yeah.
And then after all of them, you can perform the technique.
Okay.
Okay?
Yes.
So let's press?
Yeah, let's go.
Let's go. Okay, Avery. So today we're gonna press 2 different tasks. So the first one, so I want you to show me how we need to roll the resident in bed. Okay, only with one staff.
Okay.
And the other one, you're gonna practice sit to stand with one staff as well. So the first one, you're gonna be the resident, and I will show you how you can do it, and then you can be the carer, okay, the staff. So lie down for me on your back. Okay. So go a little bit more to the other side. Yes. So you are like in the middle there. Okay. So to perform, to help the residents, so first, as you told you before, you can ask them if they can help, okay? If they can't help much, it's fine. But with one physical assist, they should help you, okay? But it should be easy for everyone, for you and for them. So the first one, you can ask them to bend the knee and place the foot on the floor, and then you can try to bring the other arm, the opposite here. You can rest in the chest, and then you can place your arms in the key points of the body. The first one can be the shoulder and the other one the hip. And then you can talk to them. So you can say, Avery, so now you're gonna roll towards me, okay?
Okay.
And then 1, 2, 3, and then you can do it. So as you could see, my spine was in a neutral position. I engage my core and I use my hips and knees, okay? So the best one, because this one don't have like a function that you can move the bed up and down. So the best position of the bed would be a little bit more higher. So it's nearly close to my hips, okay? And then I can back. So I will show you again, step by step. So first, bend the knee, place the foot on the floor. Don't forget to keep your spine in the position, core activated, and then use your hips and knees. Place your hands in the hip points, so hips and shoulders, and then roll towards you, okay? That's it. So let's press, let's see if you are able to do it. So I will be the patient now. Excuse me.
All right. Patient lying flat, just ask them if they can help. Just flex the knee, and first off, before that, neutral position, activate the muscles, hip and knees, and then put your hand and arm crossing your body. Can you help me when I try to move you? You can do your best activating your muscles, and we will roll you over, okay? Spine, hips and knees, and 3, 2, 1, and go.
Okay, so I will give a feedback. So you place your hand here in the knee and the other one in my arm. So most of them, they don't have much muscles, especially around the shoulders. And when you pull them from the arm, especially from the wrist or hand, you can damage
have a
or
dislocation.
cause a dilation. So place your arm here, your hand here, okay? It'll be safe for you and for them.
Yeah, sure. Let's do that. Okay. Spine, hips, and knees. Let's flex your knee here. Good. And put your arm crossing your body. We'll roll over. Activate our muscles, trying to help me. One hand on the knee, squat position. One hand over the shoulder. 3, 2, 1, and go.
Well done, well done. So,
Acabou?
I don't know.
Acabou já?
Não, vai. Uma coisa aconteceu.
Não fala que não
Okay.
gravou.
Okay, Avery, so now you're gonna go to our second practical part. So you're gonna do sit to stand with one staff, okay? So in this case, the resident is able to help. So to be safe for you and for them, you need to keep the principles of manual handling in your mind. So neutral position, spine in neutral position, engage your core and use your legs. The other point is to help the resident, so you need to place your one hand on the shoulder and the other hand you need to place in the opposite hip, okay? And then you can ask the resident to help you. So you can give them some tips. So to be easy for everyone, so you can tell them to bring your body a little bit more forward, close to the edge of the bed, and then place the feet under the knees, right? Under the knees, under. But keep your feet flat on the floor. Okay, and then place your hands, and then you can tell them to lean forward, keep your nose over your toes, and then you can use your arms to push you up, okay? And 1, 2, 3, and then up, okay? And then they can go, okay? So let's try to press this. So tell me what I need to do.
You have to come forward a little bit, or leaning forward. Yeah, put your feet on the floor. Yeah. Bend the knees a little bit, the feet under the knees, good alignment. Hands holding the mattress, then you help me. I will put one hand holding your shoulder and the opposite hip. 3, 2, 1, and go.
Okay, so it's quite okay. So let's press again. In this case, try to use more your hips and knees, okay? Use more your back, okay? Let's try again.
Yeah, sure. Your feet is good, hands good, spine, then I will be in squat position, spine, hips and knees activated. Hold the hip and shoulder, and 3, 2, 1, and go.
Okay, yes, well done. Thank you. So now let's finish our class today.
Okay,
thanks. Okay, Avery, since we don't have a hoist, let's watch a short training video that shows safe use of one. We will use and see and practice it later, okay? So we're gonna watch a video about the stand-up lifter or stand-up hoist. So you need to know when you need to use this type of lifter, the resident must follow the simple instructions, must have at least 90 degrees of shoulders elevation, and able to grab, to hold the handles of the lifter, and reasonable trunk balance, okay? When you use this type of lifter, you must have 2 staff. And you can ask me, and why? It's because one staff can maneuver the machine and the other one can take care of the resident, okay? And this way you can minimize the risk of injuries. So let's watch the video.
Most caregiver injuries in aged care settings are caused by manual handling tasks, such as lifting and transferring residents. In this video, we will show you how to safely transfer a person from sitting to standing. We will particularly focus on dynamic risk assessment, colour-coded sling sizing, and correct shoulder positioning for you, the caregiver. Before you begin any lift, always carry out a risk assessment for both your safety and that of your residents. Check that the environment is clear of hazards and is uncluttered. Check that the equipment you're using is in good condition. And check that the resident is safe to lift and explain to them what you are going to do. For a person to safely use a standing lifter, they must demonstrate appropriate lower and upper limb strength and be able to follow instructions. If they do not, you should liaise with their physiotherapist. This is all part of your dynamic, day-to-day risk assessment. Before applying, check that straps and labelling are visible on the outside of the sling. Then, ask the resident to lean forward or assist them in doing so. Place the sling behind them, ensuring that it is centrally positioned. Then ask the resident to relax back. Secure the belt using both the Velcro and the buckle for additional safety. When you do this, remember to maintain a straight position to protect your back. Notice how the slings have colour-coded edging. This is a common feature across all Aspire slings and allows you to identify sling sizes quickly and easily. Bring the lifter into place by asking the resident to walk their feet onto the foot platform so that they are flat and so that their knees are comfortably against the knee pads. Help them to do this if required, remembering to maintain your safe working posture. Lower the lifter, ensuring that it doesn't come into contact with the resident and cause harm. Next, attach the sling to the lifter, ensuring the loops sit securely on the spreader bar. The loops you choose will differ from resident to resident. Ask the resident to hold the lifter's handles and begin the lift. When the sling becomes taut and just before their bottom leaves the seat, check that all sling straps are still securely sitting in the spreader bar. If they are not, bring the resident back to the seat, adjust, then continue your lift. Maintain good communication with each other and continue the lift until a comfortable, upright position is achieved. When moving the lifter, don't forget your safe manual handling practices. This is an example of an unsafe way of moving the lifter, putting your shoulder at risk. Remember, the shoulder joint is one of the most commonly injured body parts when moving and handling residents. Protect yours by keeping your elbows by your side and below shoulder height. When the resident is at the desired destination, ensure the back of their legs touch the chair that they're going to sit on and lower them into a seated position, continuing to communicate with each other. When the resident is safely sitting, ensure that there is enough slack in the straps and carefully detach the sling from the lifter. Take the lifter out of the way and remove the sling. Remember these steps and our 3 focus points.
You have done excellent work today, Avery. So what part did you find the most helpful?
The transferring practice helped me to understand the positions and spine, hips, and the joint position, spine, and the posture to perform the movement.
Okay, so yes, I note you use clear instruction with me as your resident, and you remember to check the place before starting, okay? So that's a great progress.
Thank you.
So keep practicing this week with your mentor, and next session I will move into communication techniques, okay? So especially clear pronunciation and use aged care specific terms. So
Yeah,
well done.
right, nice. That sounds very good. Thanks, Juliana, for your time, and now I feel more confident.
Okay, thank you so much and see you next class.
Yeah, see you then.